Aloha and welcome to our COVID-19 Public Health Action webinar, COVID-19 Vaccines in the Workplace, Employer and Employee Rights. My name is Steph Moyer and I'm the Community Initiatives and Training Coordinator for the Hawaii Public Health Institute. Before we get started, I'd like to go over some Zoom housekeeping. For all questions, please utilize the chat box or questions and answers box located at the bottom of your screen. We do not offer continuing education credits for this webinar series. And lastly, all webinars are recorded and will be available on the Hawaii Public Health Training Hui's YouTube channel. Without further ado, it's my honor to introduce you to our guest speakers today. Our first speaker is CJ Johnson. CJ is the NHPI Filipino COVID-19 Outreach and Public Health Education Specialist at the Hawaii State Department of Health. His focus is developing community partnerships to ensure that the department's in-language COVID-19 outreach and education is timely, accurate, and informed by community needs, and that trusted community leaders have access to the information and resources they need to engage and inform their communities and constituents. Our second speaker today will be Sarah Wang. Sarah is a partner with Marr, Jones & Wang, a law firm that specializes in labor and employment law. Ms. Wang has represented employers in a wide range of employment matters for over 2 decades, including discrimination and harassment cases, wrongful termination claims, union arbitrations, leave management issues, and wage and hour audits. Ms. Wang also devotes significant time to providing training and guidance for employers to assist them in managing personnel issues and in complying with various employment laws. And it is my honor to turn it over to CJ.
Hi, everybody. Thanks so much for having me. Is my screen displaying? Is my share screen displaying?
Not yet.
Oh, okay. Window went away. There we go. And oh, how about now?
Perfect.
Great. Hey, thanks everybody for having me. I'm sure some of you have seen me in the last couple of months present. I am CJ. I'm with the Department of Health. I just want to do some quick updates. I think probably most people have heard the basics by now, but I just want to let people know where we are and remind everybody that if everything I say here today, and if you do have questions or you do need more information, hawaiicovid19.com is our repository for all things COVID. We've got a lot of information there, a lot of it. We have a registration portal, set of portals. So if you're trying to find a place to get vaccinated, we keep an ongoing list of facilities and phone numbers and website links for that. We have a lot of translated documents if you work with populations that like to get their health information in languages other than English. That includes the CDC pre-vaccination checklist. So if you know anybody that's considering getting vaccinated and wants to know what they're in store for or what the questions get asked at the screening, we do have that information available in 20 languages. We have our FAQ language. We have our FAQ in 20 languages. We have a document I'm really proud of. We've worked a lot on. A home care guide is available, and I think we have that in 5 languages on there right now: Samoan, Chuukese, Marshallese, Ilocano, and Tagalog. It's a really great 50-page, very dense, but a lot of information for everything you could possibly need to know if you or somebody in your household is diagnosed with COVID and needs home care. Just our basic general, trifold brochure information is translated into 20 languages. So we've got a lot of info out there. A little status stuff. We are at, as of this week, or I think this is yesterday's info, we're at 1,260,000 doses administered. Things are going pretty well. We're getting a lot of shots in arms. We're really up and running. We do have a great dashboard also at hawaiicovid19.com where you can look at the shots total. There's also, the case, obviously, info, but it might be interesting to check out our kind of running of how our how our vaccine campaign is going. So you can look by county, by age, and by race. Those are all different ways you can break it down. You can see Kauai is leading the pack with 60% initiated. I know there's been a lot of press lately about the slowdown in vaccination rate. I would say that a lot of us that are working on it for the most part are actually less concerned and surprised by the slowdown than the media might lead you to believe. I think this idea, right, that 50% of the population being vaccinated meant that we were at the halfway point is maybe not that accurate. If you think about it, the folks that have been vaccinated were the people that were in line, that were excited, that were enthusiastic and eager, and that was going to be the easy folks, right? So from here on out, there's a lot of folks who still have questions or either maybe aren't certain that they want to get vaccinated or do want to get vaccinated but have geographic, language, technology barriers, or just don't feel a sense of urgency. So we know that that's going to be a little bit more labor intensive. It's going to be a longer process, but we're ready for it. We're working on it. I'll talk a little bit more about our strategies later, but we are continuing to develop the capacity to respond to that. And then, of course, if you want to get the latest info, you could just go to the bottom of the Hawaii COVID-19 page and subscribe, and we'll send email updates. We're also active on social, of course, all that. So for a little bit of comparison, this is Johns Hopkins. This is the percentage of population fully vaccinated, and according to Johns Hopkins, we're doing pretty good. We've really consistently been in the top 10 of U.S. states for vaccination. That continues to be the case. I think things are definitely trending in the right direction. Our strategy of rolling out the new eligibility seems to have gone pretty well for us. I know there's been a lot of questions about Johnson & Johnson. I hope that it's mostly resolved in people's heads by now, but just to kind of recap, a couple of weeks ago, there was some concerns over some very, very rare blood clots that occurred in folks who had recently gotten the Johnson & Johnson vaccine. The people that had gotten it were mostly women between the ages of 18 and I believe 50-ish, and they all got sick between 6 or so and a couple of weeks, 6 and 14 days of getting vaccinated. The vaccine was paused, and of course that's exactly what you want to happen when you're studying a new medicine, new medication. They paused. They didn't recall. There wasn't a huge panic. There was just a let's pause and research this and make sure that we come up with a good recommendation. They were paused for about a week, and then they relaunched Johnson & Johnson. They reauthorized it for use, and the only change is that we do now have a warning label on it, and there's a warning question that lets people know, even though there are side effects, and we're talking like 1 to 2 in a million side effects, so very, very rare, much rarer than the side effects for much more disease or medicines that we use every day. But we do tell folks that if you experience really severe headaches, and this is not like ordinary everyday headaches, but really severe debilitating headaches, abdominal pain, leg pain, shortness of breath, within 3 weeks of vaccination, then please contact your healthcare provider. Otherwise, if you haven't had any other symptoms, you're 3 weeks out, we don't have any reason to think that you're at any continued risk for any complications from the Johnson & Johnson vaccine. So just wanted to put that out there. We are using it. We do feel it's very safe. There is a disclaimer warning on the labels now. I know the other big piece of news that everybody's asking about is the children, right? So at this point, as of today, there's only the existing vaccines are only authorized for uses on people 16 and above, but we actually are anticipating Pfizer to be approved for 12 to 15, ages 12 to 15, probably either later this week or early next week. We're actually in planning meetings right now and with the Department of Education on how we can roll that out and do some implementation, actually do some on-campus pop-up events and try to make sure that we are capturing folks where they are, not capturing, that's a terrible word, but we're available for folks where they are, right? So stay tuned for more information imminently on that, but we do anticipate it's coming very, very soon. I want to make sure folks are aware of the vaccinefinder.org portal. This is a really easy, very convenient way. This is for folks that are online and that speak English well and that prefer to get their information that way, that have no mobility issues. This is a really good way for folks that don't have any particular needs or barriers to get vaccinated. And that allows us, everybody that uses this sort of low muss, low fuss system, frees up our resources, right, to focus on populations that do need more resources and that do need more of our support. But you go in, you enter your zip code, and actually you can even enter which vaccines you are interested in, and it'll spit out a list of where there is vaccine available. This is, again, in conjunction with the retail pharmacy program. So this is a pretty handy tool. Encourage folks to use that. We also have a lot of capacity with the 211 call center right now. We are offering registration support for Kupuna. So if you're if Kupuna in your household or somebody you know doesn't have internet access or would prefer to book with a person, we can walk them through that on the phone. If you're on Oahu, they can help with transportation. They can refer you for transportation. If you're homebound, they can help you get hooked up or get in line for a home visit for the vaccine. So the level of service on that is increasing really dramatically. We're really pleased to see that happen. This is not new news, but it's something that we wanted to get out again because it keeps coming up. The vaccine is free. There's no copay. There's no charge to the public for the vaccine. Some folks have been concerned because the sites do ask that you bring your insurance card with you. You don't have to have insurance. We do ask folks to bring the card, and that's mostly for reimbursement. It's back-end stuff among the government and the providers and your insurer, if you have an insurer. But if you have an audience with folks that are not insured or anybody asks, we just want to make sure that folks understand that insurance should not be a barrier. Anyone is welcome. Only that if you are insured, please bring your card with you. We do know that a lot of folks are asking about, do we still have to, once I'm vaccinated, use a mask, observe all these precautions? And the answer is, for now, we haven't changed any recommendations in terms of masking or public space or crowding. Everything's the same if you're vaccinated or not, for the most part. I know that people ask, well, why? Why bother vaccinating if that's the case? Well, my response to that, I think what we say is, seatbelts tend to work, but we still have speed limits, and speed limits tend to save lives, but we still have airbags. So we are in a crisis. We are in a really urgent situation. And until that's not true, until things have resolved, it is still important that we use every tool that's available to us and create, nothing is perfect. There is no perfect protection, but every layer of protection that we add, a vaccine is just one more layer of protection. We want to really encourage everybody to use all of them, including the vaccine. Having said that, there's a couple little changes. There have been a couple of changes from the CDC. So according to the CDC, people who are fully vaccinated can gather together indoors with each other without wearing a mask. So if you want to go over to your friend's house and you've both been vaccinated, take your masks off and have dinner, hang out, and have a little mini concert in your house. You're totally welcome to do that. That's considered to be very low risk. Second, if you are vaccinated, you can head over to the household of an unvaccinated household. So if you want to go over to Auntie's house and have dinner, you can go over there without masking. The exception there would be if there's someone at high risk, like someone with a chronic disease or immune compromised or older person in that household. We would discourage that, but otherwise, you're welcome to go over there, and you're basically not considered to be a vector right into their bubble anymore. So that's pretty safe. And then the last one is, if you are notified by our contact tracers, by contact tracer, that you have been exposed to someone or you've been a close contact of someone with COVID, you are no longer required to self-isolate for 10 days upon that notification. When you get your card, for those of you who've had your card, there's a lot number on there, and so what they'll do is they'll ask you for your lot number. Indeed, you are fully vaccinated, and what fully vaccinated means is 2 weeks out from your final dose or from your one Johnson & Johnson dose. You don't have to self-isolate if you're in close contact with someone who's tested positive. So that's a nice perk. And then the other perk I know that people are really interested in is starting May 11th, fully vaccinated people, again, that's 2 weeks, no longer have to follow the safe travel rules for inter-island travel. So if you're fully vaccinated, you can travel inter-island without quarantine or taking a test. Again, that means 2 weeks out. And only folks who receive their vaccination in Hawaii for now are eligible for that. If you got vaccinated somewhere else, that doesn't apply yet. Of course, all of these things we are, wanting to scale them. We do hope that it extends to trans-Pacific travel. We do hope that it extends to folks that have been vaccinated elsewhere. For now, we're starting small. We're starting with something that we know will work. But stay tuned. We are implementing that next week, right? May 11th. Your vaccine card is going to be your proof of vaccination again. The exact specifics of that, I think, hopefully we'll hope to hear from the Safe Travels program this week on how they're actually going to do it. My understanding is it's like you take a photo or a scan or something of your card and they'll upload it, and then you will literally bring your physical card into the airport as well. So as we transition from this sort of high demand, low volume vaccination campaign to a more local vaccination campaign, we're really focusing on this access barrier and really trying to make sure that we are developing and planning and promoting really local, accessible vaccine events. We've got a lot of these planned right now. A lot have been going on. This has been a kind of a marginal strategy for a long time. It's going to become a much larger strategy over the next few months. We're doing events that are promoted by, knocking on doors, word of mouth, trusted community members, health workers, holding things in safe, familiar places like churches and community centers, and focusing on creating a positive experience, promoting success stories from trusted leaders that we really believe, rather than lecturing people or scaring people into getting vaccinated. We think that's our long-term strategy for success, is just having the information that people need when they have questions or they haven't decided yet, and then making it as convenient and safe and comfortable as possible to get vaccinated. My last slide is we do have a webinar planned this Friday at noon called Partnerships for Successful COVID-19 Vaccination Pop-Up Events. Again, that's Friday at noon. We have a number of guests. We have Chantel Matangi, who's a community organizer and works for us at Department of Health, who's been doing a lot of these neighborhood pop-ups. Kaiser is going to be with us. Philcom Center, Filipino Outreach, has been doing a lot of these events. And then Project Vision, who have been really key for mobile vaccination events, are all going to be presenting and sharing their experience and answering questions. We're hoping that this will be valuable for people that are maybe part of this process. If you're a community organization or you work for a faith group or you have a supply and you're trying to better connect with your community, we're showcasing these success stories and hoping that people will come check it out. So we could share this information in the chat after too. And that is all I have. I am really grateful for everybody's time. And I'll turn it back over to Steph.
Thank you so much, CJ. So for those attendees on the webinar, we're going to do things a little bit different right now. CJ does have to hop off pretty soon. So we do have two questions for you. So first question is, we've heard different messages on laminating the vaccine card. Does DOH have any recommendation on that?
No, it doesn't matter. I think I have not, unless somebody knows other than I do, I have not heard anybody. We don't have any internal position on it. What we have suggested is obviously keep it safe, treat it like any other medical record. And one thing is take a photo of it and email yourself the photo, or put the photo somewhere on cloud storage. So if you lose your phone or something, you have it. If you lose your card, go back to the facility that you got it at. If you got it at a mobile event that we hosted, then you can reach out to us. I have a talking point I'm going to add to my deck here, because I know people, as there's more benefits to vaccinating, I know people are going to be, oh my gosh, what happened to my card? So we'll have some more instructions for what you do if you lose it. But no, I don't think it matters. We're not specifically encouraged to keep an eye on it.
Thank you.
Mm-hmm.
And then the second question is, are you going to public housing complexes like KPT, CAM4 to do vaccine, either pods or clinics?
We have, and actually in fact, HIPHI has a staff member who's been the key participant in that. I don't think she's on as a presenter right now, but HIPHI has been super, super critical in helping organize the partnership with the Hawaii Public Housing. They are ongoing. They've been doing it for a couple of months now and are doing an ongoing campaign and really making sure that we're getting, again, as part of that strategy of making sure it's as convenient as possible for people. So that, I think, it's been, like I said, that we've really focused a lot on the pods to date in terms of just high volume and people standing in line and wanting to make sure that the lines were moving. And now that the lines are slowing down, it's an opportunity to really focus on the folks for whom there are language or cultural or transportation barriers, and just getting people, making this convenient and accessible as possible.
Awesome. Thank you so much. That was our
Yeah,
last one for you. So mahalo, CJ, for joining us. And
you bet. I'll put my info in the chat, but I appreciate everybody's time.
Okay.
Thank
you, CJ. Okay, and now I will turn it over to Sarah.
Okay, good afternoon, everyone. Hopefully my screen is up. So as Steph mentioned, my name is Sarah Wang. I do employment law and try to help employers keep up with changing laws, which has really been a challenge in these pandemic times. I'm used to changes occurring, but not quite at the pace that they have been. So I am a lawyer, got to give you a couple of disclaimers. So a few caveats about the materials that I'm going to be presenting. Number one is what I just said, things continue to change quickly. I went back through the slide against the most up-to-date information shortly before this webinar. So unless something has happened literally in the last hour, I'm confident that what I'll be talking about is correct as of right now, but do keep your eyes open. Things are continuing to change. We're seeing new state and county orders. I expect to see governmental guidance out of various agencies. So things are continuing to change. Number two, these materials are really focusing on state and federal requirements under applicable laws and regulations. For any of you who might be attending who are in unionized workplaces, you all know that you're special. There are going to be special rules that are going to apply. Many of the things that I'm going to be talking about here, if you are in a unionized workplace, are going to require potentially negotiating and bargaining, or at least notification to your unions before you can simply do the things that I'm going to be describing. So I'm really focused much more on the statutory and regulatory framework. So apologies if anyone needs any clarification on that in particular circumstances, please go ahead and chat in or use the Q&A function. All right, let's see, there we go. All right, so a couple of preliminary sort of procedural issues related to the COVID-19 vaccine that can affect employers' potential risks or potential liability. One is who is going to administer the vaccine, and therefore who is going to be asking the pre-vaccination screening questions. And the bottom line is for many employers, most employers aren't going to be doing the vaccines literally themselves. Healthcare employers, you may well be. The important legal issue here is that the disability discrimination laws, certainly the federal law, the Americans with Disabilities Act, we know what that enforcement agency, the EEOC, has said. It is very likely Hawaii doesn't have as detailed guidance as we have on the federal side, but Hawaii typically will follow the federal lead. The importance there is you're only covered by federal law if you have at least 15 employees. So when I talk about the ADA, that technically only applies to employers with 15 or more employees. However, the Hawaii counterpart applies to any employer with 1 or more employees. So when I say ADA, technically that relates to federal law, but really just assume I'm talking about any employer because it's likely to apply under state law. So the Americans with Disabilities Act, Hawaii disability discrimination law impose restrictions on medical questions. They limit the times that medical questions can be asked. It can only be done if it's job related and consistent with business necessity. We won't go into exactly what that test is, but just be aware there is a threshold. And there are certain confidentiality requirements related to those questions and any answers. If you are contracting out or you are sending employees elsewhere to have the vaccine administered, you avoid all those questions. And I think that's what many employers are doing. Is the vaccine being provided pursuant to an employer's wellness program? If many employers have voluntary wellness programs, as I just gave away, in order to be valid, again, under the disability discrimination laws, a wellness program must be voluntary. And so if the vaccine is being provided pursuant to an employer's wellness program, you are not going to be able to mandate that your employees get the vaccine. And there will be an impact on what kind of incentives or how large an incentive you might be able to provide. Because at a certain level, if there is too rich or too valuable or too large of an incentive, it's no longer going to be seen as voluntary. It's going to be seen as coercive. You're really making it really hard for an employee to openly choose. Unfortunately, right now, we have very little guidance. Employers have very little guidance on what is a permissibly sized incentive. The EEOC early in January, sort of in that transition period, while the Trump administration was still technically in place and the EEOC was still technically made up of the folks who were within that administration, they issued wellness rules that were scheduled to take effect in March, and that would have at least provided employers with clear guidance. When President Biden, following his inauguration, he froze the pending, including the wellness rules. He froze all pending regulations, and the EEOC subsequently pulled back those wellness program final rules. And so we currently do not have good guidance on exactly how big an incentive can be to be impermissible and render something involuntary. But just to give you an idea, under the rules that have been pulled back, the example of permissible incentives, so small enough to still be considered voluntary, are, quote, a water bottle or gift card of modest value, close quote. Now, I'm not exactly sure how much it costs to provide a water bottle, but my guess is we are talking very, very low dollars. All right, so what about mandating vaccines? Can employers do it? Well, there are some legal issues, and one of them really relates to the current emergency use authorization status of the vaccines that are currently available. This concern is going to go away provided some or all of the vaccines end up going through the usual FDA approval process and obtain the usual approval status rather than the EUA, emergency use authorization status. The challenge here for emergency use authorization status is that the law governing EUAs requires the Secretary of Health and Human Services to ensure that people know they can accept or refuse the vaccine. And information materials related to the vaccine must say, quote, "It's your choice," close quote, whether to get the vaccine, right? That sounds like it's awfully hard to mandate. Now, there are good legal arguments as to why that does not apply to employers who might want to mandate, but most of our clients really don't want to be the test case. And we know there are test cases out there. There are at least 2 lawsuits across the country that have already been filed, challenging employers who have mandated vaccines precisely on the grounds that it's not permissible under EUA status. In Hawaii, I would say I have heard some of our public officials opining that employers cannot mandate vaccines precisely because of the EUA status. Now, those comments may not be accurate. They may not be upheld if challenged in a court of law, but I do think that those public pronouncements increase the practical risk for Hawaii employers who are thinking that they might want to mandate the vaccine. Even apart from the EUA status, so even if the available vaccines become fully approved by the FDA, there will still be some legal issues to mandating the vaccines. If the EUA issue is off the table, the general rule is going to be that employers can mandate vaccines with a couple of exceptions. Employers are required to provide reasonable accommodations in certain circumstances. So individuals who have physical or mental disabilities, under Hawaii law, individuals who have disabilities due to pregnancy, childbirth, or related medical conditions, and individuals whose religious beliefs prevent them from getting a vaccine. In all 3 of those cases, employers have to at least evaluate. They can mandate in general, but if somebody says, yes, I can't, and here's one of my reasons, it's not just that, you know, I've heard that they're really, the vaccine's really not effective, so I just don't want to get it. Oh, I'm a little bit timid. I prefer not to get shots. You know, it's not something like that. You can mandate those individuals to get it with employment consequences, assuming we're out of the EUA scenario. However, you will know, regardless of EUA status, you will have to consider employees who say, I can't do it because of a health condition, which would include pregnancy, childbirth, or related medical conditions, or because of a sincerely held religious belief. You will have to evaluate in those cases, is there any reasonable accommodation you can provide that would allow those employees not to get the vaccine without negatively impacting their employment. For those of you who have recording obligations under OSHA, or here in Hawaii under HIOSH, the Hawaii Occupational Safety and Health Administration, if you are required to keep logs, and many of you will not be, many of you will be in industries or will be small enough that you will be exempted in most cases from having to keep the logs. But if you are covered, you do have to keep logs. One of the criteria for determining if somebody's adverse reaction to a vaccine is a reportable incident is whether or not it was work related. If you mandate the vaccine, OSHA has said you will meet that test. Any adverse reaction for an employer mandated vaccine will be work related. So if the other 2 requirements are met for a reportable incident, you will then, for those of you who have to report, you will then have to report the adverse reaction. And then if you are mandating the vaccine, be aware that the time employees spend going to get the vaccine at your direction will be considered compensable time. So you basically need to treat it as on the clock time. All right, so many employers are choosing not to mandate, but maybe to incent vaccines instead, to provide an incentive. A week or 2 ago, President Biden encouraged employers to incentivize vaccines, and he suggested that you specifically do it through an incentive that is available to many employers through the American Rescue Plan Act, or ARPA. And one of the things that ARPA did is it broadened and extended the Families First Coronavirus Response Act. Many of you may remember the good old FFCRA that was enacted in 2020 and technically expired on December 31st of 2020. So there is no mandate anymore for FFCRA covered employers, which includes private employers with fewer than 500 employees. There is no longer a mandate that you provide paid sick leave and paid family leave benefits. However, you, the employer, are incentivized to provide those paid leave benefits because you are given, if you maintain proper documentation of it, you are given a dollar for dollar tax credit. Basically, you are not paying this, you are not paying for it. And one of the things that ARPA did in expanding the FFCRA is it expanded the reasons for which employees could take paid time off to include vaccination related time off. And so President Biden basically has encouraged any FFCRA covered employers to utilize that, to say, hey, employees, we're going to give you paid time off. We're going to give you paid time, even if we're not mandating it, so we don't have to pay for it. But you know what? To incentivize you, we're going to encourage you to do it. And if you do, we're going to give you the paid time. And then behind the scenes, you just keep your documentation, and it ends, and you submit your documentation to the IRS, and you get your tax credit for what you paid, and you don't end up being out of pocket. So that is definitely an available incentive for any covered employers. You absolutely can use that. All right, what about other incentives besides the ARPA time off? Well, again, as I mentioned, depending on sort of the paradox is the bigger the incentive, probably the more effective it is. And so if what you're wanting to do is incentivize your employees to get vaccinated, if you told them you would give them $1,000, you would probably really enhance the likelihood, much more so than offering them a water bottle, right, to go and get vaccinated. However, that is potentially going to create not only a voluntariness issue, but it is also potentially going to create a discrimination issue in those cases where employees have some kind of health-related or religious-based reason not to get the vaccine. They are much an employee who cannot get the incentive because they have a disability or because they have a religious-based reason. If the incentive they're not getting is that $1,000, I think they are much more likely to bring a claim that they're being discriminated against than if the incentive is that water bottle. I suppose you could still have an employee who complains over the water bottle, and so that is still a possibility. So in any event, if you are providing incentives, just make sure you're thinking through how you're going to handle employees who have those legally protected reasons, health-related, which includes pregnancy, childbirth, or related medical conditions, or religious-based. If an employee says, I can't get the vaccine for those reasons, and many employers, frankly, are giving incentives anyway. So an employee who goes through, raises that concern, provides appropriate documentation in many cases, will still end up getting the vaccine. And there may well, will still end up getting the incentive even if they don't get the vaccine. So just be mindful of that. Okay, so one of the things that I think is a real challenge for employers is once your employees have gotten the vaccine, what can you do? And a threshold question is, what is the law that you are actually bound by? What are the legal requirements? So for the most part, it is not the CDC or the Hawaii Department of Health, except to the extent that they are adopted by one of the state or county orders. And to a very large extent, they have been, but not entirely. So be mindful that the state and county orders have the force and effect of law. If they are not referring you to the CDC or they are not adopting the CDC or Department of Health guidance, there is some risk about whether or not actions are compliant. In other words, if you violate a state or county order, and the state or county order in that particular way you're violating it does not defer to the CDC or DOH guidance, there's a risk that you are in violation of the order that could be enforced under the terms of the order. I know that's a little bit confusing. I realize as I said it, that may not have made a lot of sense. I'm going to keep talking, and I think hopefully in the next slide or two, it will become clearer. The Occupational Safety and Health Administration, or in Hawaii, HIOSH, has issued guidance and can issue regulatory requirements that have the force and effect of law. There is a new OSHA rule that has been passed on to the White House, which is the last step in its review before it's issued, but there is no prognosis that I've seen, no estimated time frame for when that will actually be issued and take effect. But there could be OSHA guidance or OSHA, regulations that will come out that may impose certain requirements, workplace safety requirements on employers. So let me specifically talk about a few things that employers maybe can or cannot, or it's a little bit risky for employers to do. So the Federal Equal Employment Opportunity Commission has been very helpful in the sense that they have issued guidance, and that guidance makes very clear that simply asking an employee if they have been vaccinated and also asking for proof of vaccination status is not considered a medical question, which means you can do those two things. You can ask if an employee has been vaccinated, and you can ask for proof. If they tell you yes, you can say, well, show me your card. You can do those things without worrying about restrictions under the disability discrimination laws. If you go further, if somebody says, no, I haven't gotten a vaccine, and now you start questioning why, the EEOC says you are now at much greater risk of getting an answer that's going to have to do with somebody's health condition, and you are therefore at a much higher risk of asking an impermissible medical question and getting medical information that will have to be treated in special ways. All right, the rule for masks, and this is kind of what I was alluding to, and I think will become clearer. I'm actually going to kind of take these together, the rule for masks and the rule for quarantining. And CJ covered what the current Department of Health guidance is with respect to quarantining, which is if someone is fully vaccinated, even if they've been in close contact with a positive case, if they are asymptomatic, they're not showing symptoms, they don't need to quarantine. All right, that is incorporated. So let me back up. Okay, the current state proclamation, the state's proclamation is the 19th proclamation. That is the current version. The current version of that proclamation basically has its own special rule for masks. And then it has a separate paragraph that talks about other safety and health requirements. And with respect to the other safety and health requirements, the state order says, follow CDC and Department of Health guidelines. Follow CDC guidelines and follow requirements and standards adopted and issued by the Department of Health. Okay, so with respect to quarantining, other than travel, because the current proclamation goes into great detail about travel-related quarantine, but for non-travel related quarantine, under that order, the rule is follow CDC and follow Hawaii Department of Health. Masks, however, I think when you read the state order, are under different footing. There is a specific provision in the order that says for masks, go look at Exhibit I. The rules for masks are set forth in Proclamation Exhibit I. Exhibit I goes on for a little bit more than a page. It includes exceptions. It says all individuals shall wear face coverings over their noses and mouth when in public settings, with exceptions A through K. So as a practical matter, it may well be, we've heard CJ, I've heard others who basically say, look, CDC is saying you don't have to wear masks in certain settings, and so that's fine. You can basically follow that. If you are really risk averse, you may want to make sure that when you are allowing your employees to forego mask wearing, you're doing it consistently with the current state 19th proclamation. Now, again, that may well be amended and revised and further adopt CDC and Department of Health guidelines, but currently, and again, I just double checked this shortly before the call, or shortly before the webinar, there is still this discrepancy, in my opinion, between the language of the state order and the CDC's guidance. I'm sorry, CDC's guidance. What about differential treatment? So for vaccinated employees, can you treat them differently? Can you allow them to do more things than you would allow your unvaccinated employees? So I really think that in a lot of cases, that kind of differential treatment, that's really a form of incentive, right? It may not be a monetary incentive. There may not be sort of, you may not be able to quantify the value, but there still may be ways that allowing more things for your vaccinated employees is a form of incentive. So just be mindful again of the limitations or the concerns with respect to any time you're mandating or incentivizing. If you are hurting employees' compensation opportunities, if you are, if the, sort of the differential treatment is something like, look, if you've gotten a vaccine, we'll let you come back to work. If you haven't gotten a vaccine, you can't work. And so basically those who get the vaccine get paid, those who haven't gotten the vaccine don't get paid. I think you've got the potential concerns that we talked about earlier with respect to mandating. Just make sure you're going to be prepared to deal with individuals who may need exceptions. And in Hawaii, given what some of our public figures have said, are you comfortable with the EUA status doing the mandating? Similarly with the incentive, is that now going to be an incentive that it's no longer going to be a voluntary choice by the employee? So think about I would suggest thinking about the differential treatment in that way. So for example, if I've got a number of employers who have asked about, look, we would like to allow employees who have been vaccinated to come in and have consistently with the current state rule, but we want to allow them to come in and have meetings in person. We're still going to allow other people to attend the meetings. We're not going to deny them the meetings or training. We're not going to deny people who are unvaccinated the training, but they're just going to have to attend by remotely. And if the sort of the carrot to get people to come in is, hey, we're going to provide lunch. We're providing sandwiches. We're providing some kind of bentos for everyone who shows up in person. Sorry, if you're remote, you don't get it. You got to provide your own lunch. All right, that's one thing. But if you're saying, look, if you need to be present in person, and if you're not present in person, you're only remote, we're not going to view you as sufficiently dedicated to your job to be considered for promotional status. Or you don't allow people who aren't vaccinated to participate at all in the training opportunities that maybe set them up for advancement in their position. That kind of a denial that really does impact a term and condition of employment and or compensation, I think is going to be of higher risk. What about visibly designating vaccination status? So can you tell employees who have been vaccinated, you have to wear some kind of, vaccine badge around your neck or some brightly colored sticker on your name badge or ID badge? I think there's a good argument well, let me first say the guidance that is available out there right now does not say one way or another if employers can mandate that kind of visible designation. It seems to me like the EEOC guidance allows, I think, a good argument that you can do it, at least consistently with the laws the EEOC enforces, including the disability discrimination laws and the religious discrimination laws. The CDC actually encourages employers to do it on a voluntary basis. So different than mandating it, but doing it on a voluntary basis. I think if you do something like that, if you, whether voluntarily or mandatorily, just be mindful that you don't necessarily want to be encouraging employees to be pestering one another, to be asking, well, why didn't you? Knowing that the answer to why didn't you, hey, I don't see you having a pink sticker, you don't have your vaccination tag, how come you didn't go get vaccinated? I think you may end up, or you just should be mindful that you don't want medical or other confidential information disclosed unnecessarily or spread around unnecessarily. And you certainly don't want to allow employees to be harassed. And if they're being harassed, if the reason they didn't get the vaccine is a legally protected reason, like a disability, including pregnancy, childbirth, or related medical conditions, or religion, being picked on or being teased by their coworkers for those reasons could well be legally problematic harassment. All right, so that was a lot, but I actually think I'm still kind of on track in terms of time. So if there are any questions, I'm happy to try to answer them.
Thank you so much, Sarah. Yes, we do have several questions for you. So the first question that we have is, a few people have been asking, if you cannot mandate vaccination, can you mandate frequent testing to those who won't vaccinate in order to keep a healthy workplace?
In general, the answer to that is going to be yes. I think the question will become whether who's paying for it. I think that the challenge, the bigger challenge, and I don't know the specifics. You all may be in a better position to know what is potentially going to be out of pocket for employees versus covered. I would expect that a certain number or under certain conditions, COVID tests would be insurance covered, I would expect, but it may not be in all cases. If an employer is sort of saying, okay, look, if you haven't been vaccinated, we are going to require more frequent checks, or we're going to continue with a much more rigorous screening process for those who have not been vaccinated. I think in general, those are permissible, at least the employer is making sure there's not an additional out-of-pocket expense for employees. If there is an additional out-of-pocket expense, then I think there could be problems depending on the reason the employee is not getting the vaccine.
Okay. And the second part to that is, would it be beneficial to test all employees, but those who are vaccinated would need to be tested less frequently?
You know, there definitely, I know there have been incidents of breakthrough cases, and I understand, you know, there can be good reason to still test vaccinated individuals, but perhaps less frequently. I don't think I don't see again, putting aside the cost issue, I don't see a problem with that. If there is an imposition on the employee of the cost, I think that's where you'd want to look more closely. But in general, I don't see a problem with that suggestion.
Okay, thank you. So our next question is, can I require staff to notify management of their vaccination status and provide proof if they are vaccinated?
Yes. I would strongly suggest that you carefully define who that information goes to, but it absolutely is permissible to require employees to disclose if they've been vaccinated and provide the proof. Be careful about the proof also. I mean, I don't know if there is any exception to the COVID vaccine being reported on the COVID vaccine specific vaccine card. You certainly, I mean, I just don't know if anyone is reporting COVID vaccines on, you know, the typical yellow vaccination card that sometimes we used to have. You certainly would not want employees to necessarily have to share that level of information about other vaccines that they've gotten. But specific to the COVID vaccine, and if what you're requiring is that COVID vaccine card that only shows the COVID vaccine, absolutely okay to do that, and okay to require employees to report it to designated supervisors or management or human resources. That's fine.
And second part to that question is, can you maybe explain how that doesn't violate HIPAA?
Probably not. I don't deal with HIPAA as much. So for typically, well, here's how I guess I would answer that for HIPAA. An employer acting in its capacity as an employer is not a HIPAA covered entity. So an employer who is also a health plan, when acting in its health plan capacity, or an employer who is also a healthcare facility who is acting in its capacity as a healthcare facility, health plans, healthcare providers are in those capacities are HIPAA covered. But a healthcare provider who is acting in its capacity as an employer, so you want to know because you're considering whether or not it's safe for your employees to come back into the workplace. You want to make sure it's safe for other employees and you're evaluating your workplace issues. In that context, HIPAA does not apply. What applies is the Americans with Disabilities Act, or if you're a very small employer, the Hawaii Disability Discrimination Statute. And we know that the EEOC has advised that it is permissible to ask those questions because they are not considered medical questions.
Gotcha, thank you. Next question is, can I restrict business travel to employees who have received their COVID vaccine?
So potentially, yeah, well, yes, but I would say the risk of doing that is going to depend on how that restriction impacts your employees' sort of livelihood or compensation. So is the business travel sort of, if they're not able to do the business travel, are they basically losing out on pay? Or are there, you know, or not? Because some employees may still be able to have a full productive workload without the business travel. Someone else does the business travel. So if they are losing out on compensation or benefits, the risk is going to be higher. Similarly, if the business travel really helps them network, is likely to help them advance in their career, then yes, there could be an issue. And again, you would want to look at, especially if the impact is on somebody who has a disability or health condition that prevents them from getting the vaccine, or has a religious belief that prevents them from getting the vaccine. Is there some kind of reasonable accommodation that can be provided that will not cause that tangible deprivation of employment benefits or employment privileges or opportunities for advancement?
Thank you. Next question is, what about organizations with time-limited or project-based employment utilizing independent contractors? Are they within their rights to limit which contractors to hire based on vaccination status?
Yeah, so two things. The employment discrimination law. So all the things I've been talking about employer restrictions on on the voluntariness of vaccines offered through your wellness programs, the potential accommodations you have to provide for individuals who have health conditions, including pregnancy, childbirth, or related medical conditions, or due to religious observances. None of those rules apply to independent contractors. Okay, so you have a lot more freedom with respect to independent contractors. Okay, that's point one. Point two, though, is that literally within the last few days, we've had the Federal Department of Labor basically change positions and formally rescind the independent contractor versus employee rule that had been issued during the Trump administration, which made it easier to identify a worker as an independent contractor as opposed to an employee. I think the result of that change is that independent contractor status is going to be challenged more frequently, and an effort to claim someone as an independent contractor is more likely to lose than it was before. So point number two is, So point number one is you really don't have to worry about a lot of the restrictions I'm talking about if you've really got an independent contractor. But point number two is it may be harder now to have independent contractor status, so look at it carefully.
Thank you. Next question is, where can attendees go for guidance in the workplace besides CDC?
Yeah, so CDC, I think, really does give quite a bit of good guidance. OSHA has issued some helpful guidance. So initially, it offered a lot of good guidance on safety measures, preventive safety measures, different things that could be done from both a workplace control standpoint as well as process standpoint. And so I do think there are some good OSHA publications. Those may get superseded. As I mentioned, there are new OSHA regulations that are pending with the White House that may well, I mean, they could be issued any day. Best estimates I've heard, I think they went to the White House last week, and best estimate is they don't usually come out in less than 2 weeks. So possibly as early as next week. So keep an eye out for OSHA, what OSHA may have. There is a website that I love called askjan.org, which deals with workplace accommodations. So Jan is not like this really smart woman who knows all about accommodations. Jan stands for Job Accommodation Network. And askjan.org has a COVID specific page that can help give you some suggestions with respect to possible accommodations. And then the EEOC does have, they haven't been updated since, I believe, December, and there have been a lot of requests to the EEOC to further update their technical guidance. But the EEOC, which is at eeoc.gov, they have a technical guidance or questions and answers specifically related to COVID and pandemics. And so I think that gives you some useful information as well. So those are kind of the places that pop to mind off the top of my head.
Okay, so I do want to apologize. We aren't going to have time to get to all the questions, so we'll do one more question before we wrap up. So our final question is going to be, could you explain more about the legal status of religion in terms of being one of the protected areas if a person does not want to take a vaccine?
Yeah, so under both state and federal law, there is a requirement to reasonably accommodate an individual's sincerely held religious beliefs. In general, it is very difficult to challenge a sincerely held religious belief because it doesn't take much to establish that. If somebody says, but I honestly believe that getting vaccines is, against my religion for whatever reason. And this, I had read something a while ago. I don't know whether this remains the case post the J&J pause, although I would expect it would, because as far as I've read, and if CJ's back on, he may be able to enlighten us on this a little bit more. I have not read that the pause resulted in any change to the J&J vaccine, but I had read that the J&J vaccine was utilized certain material that may have made it more likely that there would be certain religious objections to that particular vaccine, not to vaccines in general, but to that particular vaccine. So it's typically hard to dispute or prevail by challenging someone's sincerely held, whether it is a sincerely held religious belief. Now, if someone says, well, I don't want to. Well, I don't want to because I don't like needles. Oh, wait a minute. I read somewhere that if I have a religious belief, yeah, that's it. I have a religious belief, right? If there's something about the way they ask for it that makes you really question that this is truly a sincerely held religious belief, maybe there's room to challenge it there. But in general, that's not where employers win. If there is a sincerely held religious belief, the question is, can you reasonably accommodate it? And that's going to require you to look at, what does this person do? What does their position require? Are they in a position where you need them for safety measures with regard to your clients, with regard to your patients, with regard to your coworkers, whatever it might be? Do you really need them to get the vaccine? And so they can't work remotely. There's not a vacant position that they're qualified for that you can transfer them to temporarily, right? You have to go through that process and think about, is there a reasonable accommodation? But in many cases where employers are going to win that argument is to say, look, there's just not. And I will say the law doesn't tell you this, but the way the case law has developed, it is clear that what employers have to do to accommodate a physical or mental disability, including pregnancy, childbirth, or related medical conditions. So what you have to do to accommodate a health condition is much more significant than what you would be expected to do to accommodate a religious belief. But that accommodation obligation is there under both federal and state law.
Thank you. Thank you so much for sharing that wealth of knowledge with us. So just to wrap up, I want to say a big mahalo again to both Sarah and CJ for being our guest presenters today. I'd like to thank all of you for joining us and thank the HIPHI staff behind the scenes. Please save the date of June 2nd for our next public health action webinar, and we will share the details. For now, be safe, be well, and we hope to see you on a future webinar. Aloha.